Hey everybody, my name is Jess Bizik. I'm the Director of Engagement for PJI, and we are so excited to have all of you here today for the launch of our new conversation series. Just so you'll know, each of these events, which we will roll out over the next couple of months, is inspired by our recent publication, and it is called What If? 10 Questions for Sparking Local Pretrial Change. So if you haven't seen it, my colleague Wendy Shang is going to drop a link in the chat for you right now. And speaking of the chat, we would love for folks in the audience to just give us a quick hello. Let us know where you're watching from today, whether that's geographic location or the organization that you're from. And I see those are coming in already, which is great. So I'm going to move things along and turn things over to the leaders of PJI. Welcome, Meghan and Tenille. Let's get this conversation started.
Thanks, Jess. Good afternoon to everyone joining us. Meghan and I, we are executive partners of the Pretrial Justice Institute. We share in a shared leadership structure the oversight of the organization, and we're really excited that this is an inaugural event for you not to just only meet us, but meet some members of our team, as well as begin to share in this amazing conversation about the ways we can rethink equity as it pertains to pretrial justice. We hope that this isn't the first event you join us in. We have 7 additional events, and you'll learn more about those throughout our newsletter. And we will continue to extend invitations to you and anyone you know that would be interested in participating with us. And you'll see either Meghan or myself over these next 7 sessions, as well as some of our team members as we begin to really just have informal but robust conversations, asking questions that we hope will stir up your imagination and inspire you to think differently. We're really excited about our panelists who are going to be joining us soon, and I'll turn it over to Meghan to introduce them.
Thanks so much, Tenille. We're going to be joined by 2 amazing women today who've influenced us on our equity journey here at PJI and individually for Tenille and I as well, and who have also done a lot as we think about our programming and the way that we do our work here. First, we're joined by Akemi Piatt, the director of the Health Instead of Punishment program at Human Impact Partners. And my background's in public health, and I really appreciate what the public health field has to offer in terms of community level solutions. And Amber and her colleagues at HIP focus on building collective power in communities and leveraging that to transform public health systems. So they've given us a lot of ideas about the intersection of public health and pretrial justice and how we can bring communities and systems together. So welcome, Amber.
And thanks, Amber. I'm duly excited to introduce Inca Mohamed, who is an internationally recognized racial equity practitioner, a philanthropic advisor, facilitator, trainer, and coach. And we know Inca, who she's near and dear to our heart and to our organization. She has supported us through our own internal racial equity journey. And so equally as important as her accomplishments is the fact that she's a beautiful human being who inspires us to deep thinking, to deep thinking and to be reflective. I think personally, she embodies a notion of what it means to sit at the feet of our elders. I never walk away from a conversation with Inca without being charged up and ready to think about what I want to do next and how I want to embrace equity into my life. So we're going to just get started with questions. Inca, I'm going to toss this to you first. So we're talking about equity, right? And I think language is important. So let's start by defining equity. What does equity mean to you? And then what does an equitable society look like?
Well, you know, we keep, in my work, we're always challenged between equity and equality, because we are very tied into this idea of fairness. Even though we have so much data that shows us that things are not fair, we really are holding on and hoping that things could be fair. So I think that equity, I first was exposed to the term, now that I think about it, in graduate school. I had a professor, we have a public health thing going here. I was in public health school, and I'll never forget Professor Mondragon, who helped us to understand the difference between equity and equality. And oh my God, that was a long time ago. And I find this definition helpful, that when we talk about equity, what we're striving for are conditions that would be achieved if one's racial identity no longer predicted in statistical sense how one fares. And we know all the statistics: health outcomes, education, employment, violence, mental health. We know what the statistics look like for Black and Brown people. The other important thing about equity is that it's not only trying to change the outcome. So let's say, let's do an education program, right? Some kids are not doing well. Let's do an education intervention. When we talk about equity, we talk about getting to the root causes of those disparities. And it means looking at policies, practices, attitudes, and cultural messages, how all of those pieces work together to create the conditions that we want to change. So that's the definition of equity that I got from my graduate professor 30 years ago, and still works.
I love that. That definitely resonates with me. Amber, what do you think about equity, and what does an equitable society look like to you?
Yeah. Well, first, just thank you again for having us. And I'm so excited, and I just want to congratulate you on launching this series and to arriving where PJI has. It's really exciting. And Inca, just want to say thank you so much for that answer too. I feel like you're like all of our professor right now. And I'm ready for class, teach, like tell me what we're learning. So just want to thank you for that and bringing all of your wisdom and experience too. I think I totally +1 everything that you just said, Inca, and maybe a couple additional things I would layer in there are, I appreciated your pointing to equity not only as an outcome, and maybe to add to that like for me, equity is both a process and an outcome. And you can't neglect one at the expense of the other. We actually need to be in dialogue and in processes that are equitable in themselves, and that will hopefully produce equitable outcomes, but might not necessarily. And that will sort of point us to where we need to pivot and shift things, which is maybe a second thing I would say about equity, that I think equity work and equitable work is necessarily experimental. And because we are breaking from the status quo, we are going into sort of new ways of being, and we might have unexpected outcomes from that, or sort of find ourselves in unexpected conditions. But the fact that we will need to adapt to those shifting conditions and changing conditions actually is just so rife with opportunity, and allows us to kind of be nimble and think about new ways of being together. Another thing about equity that I think is important to name here is that equity has a way of kind of bending time. And what I mean by that is that we have to have equity be inherently historical. Like we cannot be ahistorical, right? And we also have to have an eye on the future. So equity is somehow inherently historical, it's inherently futuristic, but it also has to always be rooted in meeting the current present needs of people who are living under the weight of inequitable society. So maybe that's what I'll say about that. And the last thing I'll say is that I do think I appreciated you opening, Inca, with relating equity to concepts around equality and fairness, and how those things relate to each other but are not perfect overlaps with each other. And I think, to me, equity is a very technical term. I think there's a way that it can kind of feel like in speak. And there's good work to make sure more folks understand that. But I also think there's a way that we need to acknowledge that the word equity and the concept of equity as a language sort of piece is not, it doesn't hit us in the gut the same way that words like equality and fairness and justice and compassion really hit us in the gut on a feelings level. And I do think there's value in being adaptable to what language we use while also holding some technical precision.
Mhm.
Thanks, Amber. And I think that point around history and the role of history is especially poignant when we're talking about the criminal legal system and what the history of oppression in that system is, and what we are building on and what we're trying to dismantle in the work that we're doing. And so, Inca, I'm interested to hear from you as we talk about ending mass incarceration and also ending mass correctional control, which has been another important part of the conversation at PJI, that it's not just about whether you are physically incarcerated, but the impact that the system has on your ability to freely live your life. Why is it important from an equity perspective that we are having those conversations about mass incarceration and mass correctional control?
Because those two systems work in line to contribute to the lack of equity that we have. When I was describing how the root causes and how pieces connect, you know, in New York, I live in Brooklyn, New York, and I'm always taken aback about the zip codes of who the people are upstate in the prisons. You can trace back down to where we have high numbers of kids in foster care. I mean, it's more than the school to prison pipeline. It's like coming out of your mother's womb to prison pipeline. And so it was about, when I was at Ford, I worked with this guy, Ron Mincy. And Ron was the first person that really started to educate me on how our communities were being hollowed out and the direct relationship with mass incarceration and the state of our communities. Because there's often a tendency for us to cut a problem into the smallest, most actionable piece, right? So we need more after school programs. I spent 30 some odd in youth development. So I'm definitely have been one of those people. And we want to find this solution that is going to address what we see as the facing problem. I feel with the work and that organizations like yours, the new Jim Crow, I mean, there's a lot of things that have been written that are reaching much more people. So I think that we're developing a more holistic view about what change is going to take. That it's not going to just be an after-school program.
Thanks, Inca. Yeah, we're taking on a much more complex ecosystem of what our social systems need to look like, and making it more difficult, but also hopefully more effective and productive when we think about I had a professor in my grad school who used to talk about swimming upstream, how we always need to be thinking about how do we keep moving back and looking at what came before and where we can really start to look at solutions. And the criminal legal system is definitely a place to be swimming upstream and thinking about a better way to redirect both how we're treating people and how we're spending our time and our money.
I mean, I would add one thing here. You know, from the time I was 14, my life was altered because that's the year that Martin Luther King was assassinated. And it was the very first political act I ever took of walking out of 8th grade. And since that time, I've always seen concern and love for Black people as really influencing how I've lived my life. And what I've come to understand through the work of people such as yourself and others, the Burns Institute, I have to give them a shout out. I've been working with them for like 15 years. And what I really came to understand on an emotional level is that if I say I care about Black people, I have to care about mass incarceration. It just, they go together.
Thanks, Inca. And Amber, with the Health Instead of Punishment program, HIP made the decision that this is an issue that needs to be focused on as part of the conversation about public health. And can you say more about why the end of mass incarceration is antithetical to health?
Yeah, I think, so academic research and non-academic research isn't and should not be everything. I think we should be placing more value on people's storytelling and lived experiences and sharing of that. But to the extent that it's useful, I do want to name that the public health research is very clear that incarceration harms individual, family, and community health. So maybe just to do a quick of each of those levels, like at the individual level, we know, for example, that every year someone spends in prison is correlated with a 2-year reduction in their life expectancy. In public health, we call this a dose-response relationship. So every year is correlated with an additional 2-year reduction in life expectancy at the individual level. At the family level, we know that having a parent incarcerated is considered what we call an adverse childhood experience, or an ACE. And having increasing number of ACEs is associated with a wide range of chronic diseases and leading causes of death, including cancer, diabetes, heart disease, and suicide. So we see that at the family level. And then at the community level, there was important statistical research done by the Prison Policy Initiative that showed that COVID-19 rates and caseloads grew much more quickly over the summer of 2020 among counties in what they were calling these multi-county economic areas, so basically regions, right, where more people were incarcerated. So the number of people incarcerated in a given region was associated with an increasing number of COVID cases outside of those carceral facilities, showing the relationships between folks who are incarcerated and folks who are not in surrounding communities. So it's just a matter of fact that incarceration is antithetical to health. It's like, sometimes it's helpful to have analogies. I'm my mother's daughter in this way. And like, we wouldn't, maybe we would though, ask a question like, from a public health perspective, why do high quality masks prevent COVID transmission? It's like, because they do. And we can point to the research for that, but it's not a matter of perspective. It's just fact. And these things can become politicized and come into question. But that doesn't change the fact that these are just facts, that incarceration is antithetical to individual, family, and community health.
Powerful. Powerful. Thank you. I'm actually like having a very emotional response to this conversation. I should have expected that, having to sit here with both of you and just hear your perspectives that are just so poignant and so resonant around the issues that we face. And to hear it, as you mentioned, Amber, as just a matter of fact that incarceration is negatively impacting our health. From an individual to a community level. Many of us, you included, we approach this work because, as Inca mentioned, we care deeply about people. We care deeply about Black people. We care deeply about our ability to be free and to live the lives that we choose. And I'm sure as the 100 folks or so that are on this call with us, that they've approached this work for the same reasons, that they have values that really are what support them just showing up every single day. Can you talk a little bit about the ways in which you live your values in your work to end mass incarceration?
Yeah, so I think on a personal level, I came to this work having done research in direct services with young people who were having PTSD. And I got interested in violence prevention and thinking about how we could prevent interpersonal violence at a more systems level and structure level, which is what sent me back to public health grad school. And I so happened to be in grad school 2013 to 2015 and was doing on-campus organizing with fellow women of color on campus. And one notable thing between 2013 and 2015 was that that was when Ferguson uprisings were happening. And largely through my relationships and organizing with Black women, they did tremendous amounts of very patient work with me, sort of telling me and teaching me the ways that policing and incarceration continue to be such a harmful force in the United States, particularly against Black communities. And as a fourth generation Japanese American person, I had understood incarceration in a US context to be something my family had experienced in the 1940s, being incarcerated for being Japanese American, but having the privileges of being a mixed race, light-skinned East Asian woman. I thought that that was something that had sort of been put in the past, that that was something that happened in the 40s and was targeted toward my family and my community, but was no longer an issue. And of course, as I did some learning and understanding of the ways that that absolutely policing and incarceration is a continued harmful racist white supremacist force in this country, came to sort of understand and move into work that I categorically still think of as violence prevention, but now more state violence prevention, though always still holding a special place for the ways that state violence and interpersonal violence can really drive each other, and thinking about the ways that the Anti-Police Terror Project, for example, really teaches us that all violence is state violence. So that's on a personal level. And I would say on an organizational level, you know, HIP is a very value-driven organization, and we recognize that our values are also our politics. So, you know, there are sort of 10,000 ways to approach this kind of work, this kind of equity work, and having clear values for us around racial justice, authentic democracy, emergent practice, and other things really allows us to narrow down what policies we support, what practices we perpetuate, and what partnerships we enter into with a deep amount of accountability.
Thanks, Amber. I really appreciate that idea of values being the grounding, you know, and what you can go back to when there's so many directions that you could go in your work, or so many issues that you're feeling overwhelmed, that values can be that compass. And we're finding that in our work with communities as well. You know, it's those conversations about values early on create that shared understanding and shared space of, like, even if we disagree on the details, this is what we can go back to. That's a shared point of what we're trying to achieve, be that equity, safety, liberty for folks in the community. But also those conversations can be hard and emotional because they are very personal. And so, Inca, we'd love to hear some of your advice. You've worked with organizations, including PJI, about pursuing equity, and love to hear about how you coach and guide your clients about centering values in this work.
Well, I have to admit, I'm a bit jaded about values, and jaded in that I've worked with a number of organizations where I find when people talk about their values a lot, it's often as a way to not really live them out. So I'm just a little suspicious of when people start off with "this is our value." So I will acknowledge being a bit jaded. Where I try to work with groups around values is, what would it look like if you were living that out? Because we often have really wonderful words. We believe in the value of every individual. And, you know, we say really wonderful things. Then I go into an organization and I see that people feel like they're not really valued. And so what I often work with organizations to do is, what are the 5 to 6, I never like to go past that, behaviors based on your values that you can really be held accountable for. And I encourage people to have check-ins on those values and to see how are we really living out these values, because they can sound really good, but I like to get down to how would I know that you're practicing this? Because someone, something I've run into a lot is how people treat each other in offices. So the brilliant attorney comes in, I work with a lot of advocacy groups, and doesn't speak to anybody, but they're so brilliant, it's okay. Then when I'm interviewing the administrative staff, what I'm hearing is they don't have any respect for me here. And I'm going, whoo, different ways of expressing that same value. So I like people to get as concrete as possible. And one of the tools that we've included in the chat is a racial equity decision-making tool that is a very nuts and bolts way to go about taking your values and applying it to a process, a decision that has to be made. And it gives you a series of questions to ask yourself so you can really see if you are living up to the values you espouse. So I like to be very concrete with people. And I think tools like this are very helpful because, as Amber was saying, you both have to have a historical view, you have to be futuristic, and you have to be willing to experiment. That's a lot to manage. And having some tools that can help you manage that. What's the historical reason that we need to address this issue? For example, what would something look different? How would we make it look different? So that's my take on values.
And you got a lot of love in the chat box, Inca, around the idea that if we're not living the values, then having the conversation isn't enough. So thank you for that.
They work
and of
in
course,
one of those organizations that I worked in.
And of course, we're running up against time, which we knew was going to happen. But Amber, we want to give you the last word in just talking for a minute about partnerships. And fortunately, the idea of community engagement and community empowerment is taking hold in the criminal legal system conversations, which is fantastic. But it's relatively new to a lot of us who are doing this work. And we know that that's really a cornerstone of what you do at HIP and making sure that community voices are raised and that it is done in a way that is reflected in action and not just in word. If you have a few words of advice to close us out on what we can learn from your experience on how to have meaningful and powerful community partnerships.
Yeah. So maybe the first thing I'll say is, like, to be honest, like, to keep it real with everyone, public health is not doing a great job at addressing the harms of incarceration. I don't want to pretend we are. That does not mean that there are not lessons learned. So, one thing to lift up, of course, is that the American Public Health Association has passed 2 policy statements that I think are relevant to this conversation. One in 2018, I believe, around addressing law enforcement violence, and one last year or 2 years ago around addressing the harms of the carceral system. And in there, for example, they call for the end of bail and pretrial incarceration. So I think in practice, though, and really actually living out those values and living out those policy statements, we still have a lot of work to go. So one thing that HIP has been working on is trying to sort of make these meaningful but manageable and realistic experiments for people. And one resource I would lift up to kind of illustrate that is our recently released Liberation is Essential resource, where we go through the 10 essential public health services and give folks ideas of bite-sized actions they could take related to work that people already do to try to mitigate the harms of the carceral system.
Thank you
Amber,
so
thank
much.
you. That was a wonderful last word to have. I did put a question in the chat about the time. I'm getting into this conversation so much, I'm really upset to have to turn it off. So let us know if you enjoyed it, if you'd like a little more time. Is this your sweet spot on time? That would be great. Super fast, a couple of announcements. Our next, more time, I'm getting the picture. Our next event will be on Tuesday, August 9th. Again, this is related to our What If publication, and the question we'll be addressing then is about decriminalizing behaviors related to health and basic human needs. So Amber, we might have to come back for that one too, right? Stick with us. You can register for that event in the chat. Stay tuned for a couple of big emails coming up from us soon. We'll have a follow-up on Friday with the recording of this session, some bonus resources that you can use and share with your resources. And today we are, just for you all, launching our brand new Pji Help Desk. As you know, we have been working with the field for years and years, providing feedback and guidance and resources. But we have a brand new link that again we'll share in the chat where you can ask us questions. And I cannot even tell you how excited our team of experts are to start responding to those requests. So you can start putting them in today. Also, thank you to everyone, Meghan and Tenille for your leadership, Inca and Amber for your expertise. It was a pleasure to be with you all. And thank you so much to everyone who joined us. I'll be less nervous next time, and we'll do it again in 3 weeks, okay? Thank you all so much. Have a wonderful afternoon.
Take care,
you
everyone.
for the
Appreciate the
opportunity.
conversation.
Yes.